all, thank you to Apollo Hospitals for inviting us here, and a special thank to Arvind for making this session possible, because since we started in 2014, Apollo Hospitals has been helping us conduct sessions across country, and he has been always helpful and guiding in whatever we are doing. So today, I'm going to introduce what we are doing in terms of at the National Resource Center for EHR Standards, and what we are doing to disseminate standards in India. So first of all, a refresher, because I'm not going to tell you in detail about what an EHR or electronic health record is. Everybody in the room must be already knowing. But just to refresh it, and especially refresh it in the way as a standard tells you. So there is a standard called ISO 18308, which is part of the EHR standard 2016, which talks about in terms of what are the essential attributes of an electronic health record. So without giving you the exact text, which you can go and look it up, these are the important ones. It needs to be, it's essentially everything that a doctor or a hospital does, just that it is in electronic format. And for the virtue of it being electronic, there are good and not so good attributes that we need to care for and we look for. So essentially, it is one or more repositories, it needs to be connected, it needs to be available, it needs to be secured, and it needs to be accessible to authorized users. So there are a lot of ink already has flown in terms of what are the benefits of EHR. And I'm not going to take your time extolling the virtues of it and the need for it, etc. It's already there in terms of literature. But I'm going to bring you to the last part of that slide, where I think is the entire essence of using an electronic version of medical record is necessary. And I will highlight only 3 key participants in that ecosystem. One being the patient herself. And to that person, I think the biggest benefit of using an electronic health record is that it's availability. It will be available anywhere, anytime, for the purpose of treatment, for the purpose of reference, for the purpose of study, or whatever. The second big need is the integration that it will bring in terms of across the ecosystem of health. You go to a diagnostic center, you go to a pharmacy, you go to your GP, you go to a hospital, everywhere everybody is looking at the whole composite information, everybody is feeding into the same thing. So integration is one of the key important aspect for the person. And no paper. That's one beauty of it. The doctor, who is another very important, essential participant in any electronic health record use implementation, is that there is going to be availability of history. You will not be sight-blinded. You will not be making calls or taking decisions in absence of information. Whatever, wherever has been captured is available. You can look at it. The other one is, it creates evidence. Not only for what the doctor is prescribing or the course of action that the doctor is taking, it also, because it helps him refer back to it, in sense of go back and see what I did, how many times I did it, and what was the efficacy of it. And therein lies the learning aspect of it. The system can help you unlock your own practice, your own habits of doing what you do in the scenarios that you do it. With IT thrown into it, the computers can bring out interlinkages and connections that you have missed, that you have not even thought of. So this is one key aspect there. The other big aspect, which I have clubbed together as society, and you can read it as policymakers, as decision makers, as government, or as hospital, or anybody. But I think in terms of society, the important aspect of having an EHR is real-time statistics. It should be possible to understand what is happening where and how many times and what we need to do. And that, I think, is where the word focus is important. In India, the scarcity of resource, the scarcity of expertise, and our inability to reach the entire corner of this country requires us to focus on what is essential, what is achievable, what we can do in the short term, what we can do in the medium, and what we can do in the long term. This availability of statistics, the linkages, the hidden meaning, the efficacies, everything will allow us to focus much much better as to what we want to do. So as the standard would tell you, an electronic health record will contain these many kind of records. And if you look at it, it's essentially every kind of record that you already create. It's just that it needs to be in electronic format. And since it is an electronic system, and it is a record-keeping system at best, it is a regulated record-keeping system, there has to be certain requirements about it. So there's a whole standard available for giving you the requirements that it must be met at a granular and a very fine-grained level. And some of which are here. It needs to have a structure, it needs to have content, it needs to have inclusion of clinical model, it needs to have exchange possible, it needs to have privacy and security, you cannot lose focus of that, it needs to have legal consideration, it needs to have ethical and cultural aspects taken care of, and things like that. So looking at all of this, since 2010, Government of India has been working towards coming out with a set of standards to create interoperability possible. The purpose of going towards a standardized EHR is that you make it interoperable, like I said, anywhere available, anywhere accessible. So broadly, although it is 35 individual standard which has been put into that document, if you just club it, they are into 3 broad sectors. One of them is about the architecture and data content. What you should be capturing, how you should be capturing, and what you should be doing once you capture it in terms of what is the format and etc. The second broad block is about exchange. Once that you have the data with you, how do you access it, how you make it available to another person, and how all of this will work together, how systems will work together, how the data will work together. And lastly, and not the least, the access and security aspect of it. How do you ensure that it's secure? How do you ensure that it is available to only those people who should be looking at it? And things like that. So there is a bunch of policy statement also given in that document. The idea is that interoperability is going to fuel the integration, and integration is already the need of the hour. We are already on converged device. You no longer look at mobile phone which doesn't have camera, which cannot play videos, with which you cannot make VoIP calls. So convergence is what is making life simpler, and for some maybe complex. But the idea being that we need to have integrated healthcare. I think we are already long past that mark which says we can do things in isolation. We need to look at the entire health infrastructure, the entire health ecosystem as a one whole. And once you start looking at it as one whole, then the idea of what, how, where, when, in which manner starts making sense, and then we start working on it. I think it is important to cover the entire spectrum. You cannot just look at one aspect of it. So with that view, and understanding that there are broad gaps into building such an ecosystem, sustaining such an ecosystem, the idea emerged that there has to be a center, a set of people who are going to make it possible for everybody to come on board. And although it started with a small interim center just for SNOMED City, this year in February, the Ministry of Health upgraded the center to a level of resource center for EHR standards. The idea being that you identify the gaps, create capacity to fill the gap, and then go ahead and fill the gap. Looking at those, the NRC has identified 6 major gap areas. One of them is obviously education and training. Who is going to talk about these standards? Who is going to tell people where to go, what to look for, which pages are more important than the other ones? So education and training, and this is one part of it, where outreach, awareness, sensitization, and sometimes right down to looking to your code, your practice, your process, and saying this is what you need to change, this is what you need to correct, or this is what you need to evolve to, or this is what you need to strengthen. You may be already following it without knowing it. So our job is to tell you how, where, and what. The second one is tools and technology. In order to implement a standard, it's not that easy. First, you need to understand the standard, then you need to make an electronic version of its compliance and key code pieces, and then put it into a system which will make compliance available in the entire system across. So there needs to be a lot of tools and technology that needs to be provided, and there are some key tools and technology at the base layer and at the middleware, which is where it is important. essentially, NRC does not look at creating an EHR or creating an HIS or creating your PHR in your phone. That is left for innovators to do. That is left for hospitals to come up with. That is left for software manufacturers to come up. What we provide is how to make all of them standard compliant. The third part is the implementation support. Even when you have the tools and you have a good know-how of what that standard demands, still there is a lot of confusion as to how do I need to go about in doing it. And that is where it gets interesting, because we help you do even that. The other ones is we provide a lot of advisory, we provide extensions, we provide references and things like that. We liaison, and we also advise not only hospitals and doctors but also government agency. So we are your partner in EHR standardization. The entire spectrum, right down from adoption all the way to going back to your use, we can help you. All of it, as Arvind said, in terms of cost, is free. Free to anybody. The tools and technology that we produce are open sourced, provided with the code that you can modify. It is all Apache licensed, so you can just do anything with it. You can include it in a commercial application. The training and education that we provide is also free. All the materials available from our website, you can go there, you can download it, you can look at all the presentations that we have given. You can write to us, we'll provide it. In fact, if you can muster a bunch of people, we'll come down to your institution and do it for your institution also. In fact, up till last year, we were doing large sensitization program where we went to city and did it, where Apollo Hospital helped us to do it 4 places. Columbia Asia helped us do it at Bangalore. But now we are even going institution to institution and individual to individual. Every day, almost one or other company bringing out their people to our lab. We are sitting them down, telling them what they want to know, and sitting with them, debugging their own code, looking at their own application and saying how to make it better, how to make it standard compliant. That is the beauty of it. We have already done a lot, and we have achieved a number of things. We have already issued SNOMED CT affiliate license. SNOMED CT as a standard organization requires countries to become members. Individuals don't become member to it. But once a country becomes members, its use within the country is regulated by the country itself. IHTSDO does not do anything about it. And Government of India decided not only to become member of IHTSDO, but also to make SNOMED CT free to anybody for any purposes in the country. So whether you use it in your commercial application, whether you use it for research, whether you use it for teaching, it is all available for free. All it requires is that you sign up as a licensee with us, and we'll issue a license. It's just a matter of going to a website and putting in your detail, and we allowing you access. We have already issued about 244 affiliate licenses. These are hospitals and manufacturers. They are not necessarily individuals. About 60% of it are commercial companies. The remaining are hospitals, and in some cases, individuals who are researching on independently. We have done an amount of workshops and training. We have already released subsets of 7 ref sets targeting the public health, and our tools that we had at the below, we already provide SDK for DICOM integration, for HL7 integration, as well as SNOMED CT integration, free of cost. Obviously, we have already seen about 500 downloads of it till date. And we have outreach to a number of people who are key to making and bringing those change. NRCS is still working on a lot of things which are required. One of the biggest things that we are working on is to create the codes for drugs and substance in this country. And that is one of the big gap every person who has ever built a medical system knows. Essentially, in India, we do not have a codes for drugs. We are using either RxNorm, or we are going to SIMS and MIMS database, or we are just trying to create an inventory in our pharmacy records and trying to make do with it. The idea is that all drugs available in India should be available in codified format, along with SNOMED integration. The idea being that we already have a fantastic terminology to use. We should link these codes with the available clinical terminology, making it possible to unlock just by knowing as to what medicine was prescribed. It is potentially possible to know what all has happened. And that is the point of it. The other key gap is we are working with STQC, which is a body under the Ministry of Electronics and IT, to create a evaluation and compliance framework for compliance to standard. I hope that in coming 3 to 4 months, STQC will announce the pilot program for evaluating software and deployments or installations to check what is the level of compliance as per meeting the requirements of EHR standards 2016. The other work that we are doing is we understand that we have a limited reach. We will not be able to reach everywhere. We will not be able to go everywhere. So we are going to put much of what we already do as a standardized training into video tutorials, which you can directly be able to download and maybe say, show it in your own programs, and people will be more aware of it. So we are drawing, we can already conduct a number of webinars. People can attend it and things like that. So I welcome you to involve us into your endeavor, to involve us into become compliant to standards, to make the dream of anywhere accessibility of electronic health record for every citizen of this country a reality. Thank you very much.